Hi, this is Dr. Chris Ling from the Integrative Medicine Clinic, and I want to bring you some important information about omega-3 fish oils and health, cardiovascular health. 4 studies now have been published in the last 2 years that show significant decreases in heart attacks in people taking omega-3 oil supplements. The most recent study of over 135,000 people was published just a few days ago in the Mayo Clinic proceedings. Omega-3 oils are long-chain fats that are primarily found in fish, cold water fish like salmon, sardines, herring, etc. And we know that they confer significant cardiovascular benefits and they're quite safe. So let me tell you a little bit more about this study. They followed over 135,000 people, and they found that people that took 1 to 2 grams of fish oil a day, EPA and DHA, that their risk of a fatal heart attack, dying from a heart attack, was 35% less. And the risk of having a heart attack was 13% less if they're taking 1 to 2 grams of omega-3s. And these omega-3s include specific omega-3s, EPA and DHA. So when you look for a supplement, you want to have about 1 to 2 grams of EPA and DHA. Very, very important. Most Americans, it turns out, are really low in omega-3s. Now, cultures like the Japanese who live and eat fish often have naturally high levels of omega-3s. But most Americans don't eat cold water fish like salmon and sardines very often, and we don't naturally have high and protective levels of these omega-3s. So again, the dose is about 1 to 2 grams. You want to make sure that you get 1 to 2 grams of EPA and DHA and not just fish oil, because those fish oil capsules can have other oils that are not that helpful. It's really the EPA and DHA that's very important. They also said in this very large study that the side effects of fish oils were very low, virtually non-existent, and that there wasn't any significant drug-drug interactions. And although there's kind of a thought process out there that fish oils can cause significant bleeding at high doses, it turns out they found no significant evidence of that. And that was also corroborated in a study in the Journal of the American Medical Association. They went on to say that good quality omega-3s are not expensive, just $1 to $2 a day to get 1 to 2 grams of a high quality fish oil. Now when you look for an omega-3, you do want a high quality professional product if possible, one that is going to have the right amounts of the EPA and DHA, and one that's going to be pure and very unlikely to have heavy metals or other contaminants and pollutants. This is really important. Heavy metals like mercury that can be in some fish can be really detrimental, and then you're not getting the real benefits that you're looking for. So this is I think really clear now that adding omega-3s and good cold water fish can significantly lower cardiovascular risk. Other things that we know lower cardiovascular risk is to eat a colorful, nutrient-dense diet with plenty of vegetables, berries, green vegetables, healthy cold water fish as you can, and to avoid processed foods and fast foods. Those clearly are not helpful for you. Getting moderate exercise is important, and taking your omega-3s, and then also knowing your personal cardiovascular risk. What is your cholesterol? What is your family history? And even finally, we can do things like looking at your arteries, looking at your carotids or your coronary arteries to really, really understand your risk, particularly if you have a family history. So to summarize, omega-3 oils are clearly beneficial. They have virtually no side effects. They don't cause bleeding, and they're not expensive, and they significantly lower the risk of a fatal heart attack by 35% and a heart attack of any kind by about 13%. At the Integrative Medicine Clinic, we'd like to bring information to our community through videos like this to help improve health, and in the clinic, one patient at a time, partnering with patients to improve their health. We wish you the very best of health.